starting point is to be very accessible for people. So we try to think about, well, what's happening for the whole person, and then we can work on the particular presenting issues, but we want to know what else is happening in someone's life, and that makes a big difference to helping people work through their health issues.
No one is immune from ill health. That includes people in power and people like you and me. I used to be a nurse helping to run a ward, and I never expected to experience ill health like I went through. It can happen.
The regular visits that I have with the health personnel here at CHIRP mean that the nudging in the right direction towards long-term health is happening on a regular basis, and that gentle, friendly, professional, informative, diagnostic, wonderful help just keeps you on the path, and in the long term that helps me to stay healthier, and I'm sure it is the best way to manage your health when it can be very much otherwise.
When I went here, I embraced it. Everyone was so friendly, non-judgmental and professional and discreet. It didn't matter if you came in with, trachea or whatever, you're homeless, it didn't matter. We all felt equal, and we all were treated equally at the reception. It didn't matter what, and I loved that.
The knowledge that these three institutions in the one community all coordinated to look after a crisis that I was having was very comforting, and I have the feeling that in this community I'm well cared for, and that's a real blessing.
We have a great range of services here, and the thought that these are gradually going to have to be shaved or reduced is heartbreaking.
If we lost CHIRP to Castlemaine, you would find a whole lot of older people in really diabolical strife, but also a lot of the younger ones, people who have troubles finding, there's homelessness, and they have relationship problems with parents and neighbours and getting jobs, and I think that if they don't have the counselling services and the support services, they're going to be in more diabolical strife themselves.
For somewhere like Castlemaine, which now services a community of, about 16,000, 20,000 people, we do deserve to have the same level of care, the same standard of care that they have in the cities.
I believe that people who provide local services, they're on the ground, they know their community, they're best able to meet those needs because they get a flavour of what's going on in the community. And I think that what governments often mistakenly do is withdraw financial support for services such as these, and it's short-sighted because there is a resulting loss of health and social amenity.
In terms of value to the community, I don't understand how government can diminish the importance of rural health, because in the longer term, the more preventative health we manage to organise, the better support when people are in difficulty we organise, the fewer hospital admissions, the fewer needs for long-term care. And to me, it's a no-brainer that it is worth $10 for every dollar invested.
I'm sure that by being local here as a local service, the availability of those people who are professionally helping means that we're much more willing to engage with them. Whereas if they're a long way away in Bendigo or having to go down to Melbourne, people aren't going to be bothered. And if they have transport difficulties, or they're old, or they can't walk into town or whatever, those consultations are not going to happen. And that means that the care will not occur, and complications, expensive, difficult, traumatic health complications will occur to everybody's detriment, not just the people themselves, but to the finances of the community as a whole.
Why wreck it? We're so lucky to have something beautiful. I mean, this is Australia, and we are not a third world country, and we deserve to have something that works.
The government needs to invest in CHIRP community health services because it is the future. We're going to have more primary care services in the future to deal with our rising chronic disease issues and to support communities to also find some of their own solutions. And I think that that's what we do really well here. We work so closely with our community. We've got so many volunteers who assist us with social connection as well as physical activity, and we need to continue building on that. That's the future of our health system.